Hello, my name is Dr Saima Sharif. I'm an Obstetrics and Gynaecology Doctor at North London Hospital. I'm married and mother to 3 beautiful children, aged 11, 7 and 3 years old. The BPF have asked me just to make this short video about my SARS-CoV-2 illness, and so I shall begin. We had a few positive patients on our labour ward. A week later, a lot of the doctors became unwell, including myself. The initial symptoms I developed included a dry cough, headache, dizziness. The same evening, I developed a high-grade fever, and this lasted for over 5 days. It was associated with extreme lethargy, and I was sleeping 12 to 15 hours a day. I then developed severe muscular aches, and by day 10 I had shortness of breath, and this was the most emotion distressing symptom I experienced, and for my whole family. I was eventually diagnosed with pneumonia. I did get better, but then I had a hacking cough. It was quite extreme, whereby I wasn't even able to talk. I then developed post-viral fatigue, something I've never experienced before. I remember climbing a set of stairs and feeling really short of breath and tired, so I had to rest at the top of the flight. The kind of things I did for my recovery included hydration, and this was really important during the fever. I was taking paracetamols every 3 to 4 hours, and during the diagnosis of my pneumonia I was taking the antibiotics. At the time we weren't clear what to take, and I was taking clarithromycin. I was also taking Piriton, and a salbutamol inhaler was prescribed by the A&E consultant for my shortness of breath. I was also taking high dose vitamin C and D, drinking lots of hot drinks including lemon, honey and black pepper, peppermint tea, having fresh soups even though I didn't have an appetite. The cooking was done by all my beautiful friends and family, because the whole family was self-isolating at that time, which was so kind. The psychological sequelae is really important. I was self-isolated for 7 days, unable to see my children and my husband. I had to video call to communicate and reassure my children and the rest of my family, and my husband was amazing throughout the whole time. I was seen by the paramedics and told I wasn't unwell enough when I had shortness of breath. I was turned away by my local A&E, but again just told to self-isolate when I was really scared when I had the shortness of breath, and then that was without assessment. I then went to another A&E, and they eventually investigated me and was diagnosed to have the pneumonia. However, there was more distress as I was not being tested, because at the time the policy was that you were only swabbed if you were admitted to the hospital. So the whole process of the illness, the assessments and receiving medical help was quite stressful for me and my whole family. I did recover, and my advice to the community is, especially the BAME community, is to stay home and stay safe. And I really hope this video was of some help. Thank you.